my journey to prescribing psychology. So I've been a psychologist for about a little over 30 years now, and a clinical background. I also have a background in neuropsychology. I was trained in neuropsychology, and in fact, I did my internship in Nebraska, Omaha, at the medical center there. I don't think the internship exists anymore, but so I have a strong background in neuropsychology, and I spent many years as a younger psychologist working in rehabilitation facilities, and I had a lot of interaction with serious medical disorders, and really got very exposed to that. I worked very closely with physiatrists and rehabilitation physicians. I did a lot of work with brain injury and chronic neuro illness patients. So through that, I became interested in kind of the medical pharmacological side of things, and found out that they were starting a fledgling program to provide training for psychologists interested in psychopharmacology down at New Mexico State University in Las Cruces. So I actually started attending classes there in the first iteration, which was in the late 1990s. Our instructors, when I went through it, was a combination of, for the medicine components, it was all physicians that taught us, and the weekends were quite intense. We went through, all major areas of pathophysiology, all the major organ systems. We had a strong section of pharmacology and psychopharmacology, strong sections of anatomy, physiology, pathophysiology, for a 2-year period. So it's quite intense. I mean, it's not, and then we in my group, and I'm sure it still goes on to this day, we had assignments in between during the times when we weren't there. And you really had to be on your toes to get through it. And we had a section at the end of pathophysiology where we had to do a physical examination with the patient being observed by the physician supervisor, and we had to pass that as part of our process. As part of the training in New Mexico, one of the requirements is to do an 80-hour clinical medicine rotation, and to do a 100-patient, 400-hour patient care hour, basically over a period of a number of months or a year, where you're working with patients with specific medication issues. So the way it works in New Mexico, and I can tell you in detail how it went with me, is we are to find a medical setting and have a physician supervisor or more than one physician supervisor to go through basically a process of teaming up with the physician and working with the physician on patients that have medical disorders. And in my setting, since I'm in a large outpatient clinic, it was pretty straightforward. I actually worked with 3 of our doctors, and I was able to team up with them and sit in with them in examining patients, and I was, they worked with me to actually get in and examine patients with them in terms of physical examinations, and very educational experience for me. I learned so much because I was able to sit down. We would look at various clinical presentations. We would be able to come back and talk through what our findings were and come up with a diagnosis to really learn how the physician processed thinking about the case, and to bring those kinds of skills to bear into my work as a prescribing psychologist. Because one thing you do end up doing when you're prescribing psychology, because I can speak for myself, and I'm sure my colleagues would say the same thing, is you do kind of think about patients in a more expanded way when you do this, because you start thinking more about the medical signs more carefully. Not that psychologists don't do that, but you think more about these signs and symptoms, and you think more about various medical conditions that might be occurring or co-occurring. Once the psychologist finishes the practical training and completes the coursework and obtains the master's degree, then the psychologist is almost eligible to apply for a conditional prescriptive certificate. However, the psychologist first, importantly, must pass the PEP examination, which is the American Psychological Association exam, and I believe it's called the PEP stands for Professional Examination for Psychopharmacology. I can't remember, but the PEP exam, the psychologist must pass the PEP exam first, because you cannot apply for the license until you do, and that is an extremely rigorous, extremely difficult examination, and it takes really, most people prepare for months before it. I can tell you from personal experience, and of course, comparing the licensure examination for the general psychology license to the PEP, there's no contest. The PEP was so much harder and more rigorous, really. So you have to pass the PEP first, and then you apply for your conditional prescriptive certificate. So once you get that, once you obtain the conditional certificate, then you start in on your 2-year conditional period. The way that the New Mexico law works is that the psychologist must have a 2-year period of supervision, supervised prescribing. And the supervised prescribing requires a total of, it is 96 hours of supervision over a 2-year period. So it really breaks down to roughly 4 hours a month with a physician. So it has to be with a physician. And so in my personal experiences, I had 3 physicians which were out of our clinic. Really, they were the same 3 physicians that I worked with for my practica, and I knew them all. 2 internal medicine and 1 family practice, who also had a background in, has a background in emergency medicine. And so 1 hour a week I would meet in rotation with these doctors, and it worked out well for everyone because they have busy schedules and I do too, so we were able to work it out 1 hour a week. And then I also worked with a psychiatrist here locally, and I met with him 1 hour a week as part of the process as well. And so that experience is, again, it's just kind of adding on to what you've already learned. By then, you are prescribing. You're prescribed medications by then. And of course, the way that our license works is there's going to be a collaboration between the psychologist and the healthcare provider, the primary care healthcare provider. And so the supervision going through that, it may take a number of forms. So it might be that, in my case, one of the physicians who's my supervisor is also treating a patient that I'm working with, and so that might be the collaborative relationship right there. Or it may be another physician, and so I may then be connecting with another physician in addition to working with my supervisor during that period. So there's a lot of interaction with the medical provider going through that conditional time frame. So you go through the 96 hours, and the board requires, in New Mexico, the board requires a very careful accounting of this. So they require that you have a listing, of course, well masked and confidential, but you have a listing of all your patients, and you use a number to mask for confidentiality purposes, and what the diagnosis was, medication or medications used. You chart your supervision hours. You have to show them that. You have to provide that for them. So you get to the end of it, and you reach that point where you've completed the full 96 hours, and then you're eligible to apply for the unrestricted license at that point. This is a woman who came to me being treated for attention deficit disorder, adult ADD. She was on very high doses of stimulant medications, and she came in because she was troubled by the fact that if she missed a dose, if she tried to stop taking her stimulants on the weekend, she she could hardly get out of bed. She was so, her motor had gone down so much. She'd been on these stimulants for years. And so when I saw her, she said, I don't even know if I have ADD. I'm not even sure if I do. Because this was started years ago, and the person who saw me just asked me a few questions, 15 minutes, and we started the meds, and I don't even know if I have it, and maybe I could get off of these meds. And so I said, well, sure, let's do that. So first thing I did was I did a full sort of workup with her, a good ADD workup, including the behavioral checklists for self and observer, and I did some continuous performance testing with her on my computer, and I just kind of did a workup with her. And my view was that I didn't think she had ADD. I thought that it was probably not a correct diagnosis for whatever reason. So I said, well, let's talk about it. Let's see about maybe you could come off of these meds. You've been on them for a long time, so it's going to be a long, slow process. But we talked about it, and I could just see her eyes light up. It's like, you really think I could actually get off of these? And I said, well, I think there's a good possibility. And I also think that not only that, but you can learn some psychological skills to help you cope through this process. My view of this particular patient was that more what was going on with her was some chronic anxiety than ADD. And so we kind of worked on that, and she really took to it. I mean, I actually sent her to a class and on mindfulness, and pointed her in the direction of some books. And so at the end of the day, she was able to successfully come off of the stimulants that she had been on for probably a decade. And it was a huge thing for her. And I got to tell you, for me, it was powerful, because when I was going through the program at New Mexico State, we kept getting hammered into us. The power to prescribe is also the power to unprescribe as well.